Today I'll be talking about copper peptides, GHK Cu. Now, you might have heard about them in the context of skin health, and there's a lot of wonderful research to show that it has wonderful benefits for skin health and for anti-aging. Now, the wonderful thing though is that it actually also has benefits systemically. And I did a deep dive into the research to see what's actually just a big fad and what people are hyping about, because a lot of my clients and patients, they are injecting a lot of peptides these days, and not always safe ones, sadly. Now, there are a few peptides out there that are potentially very promising, and then there are some peptides out there that might potentially not be so safe. So today I want to talk about copper peptide. And copper peptide has a lot of research on its effectiveness and its safety on the skin. Now, you can put it on as a serum, you can use it with microneedling, you can go to your dermatologist or your beauty therapist and get some skin care done. And it has been shown to really improve skin quality, skin aging. It has been shown to actually improve skin laxity as well. So that's a really common thing that people need when they've had Ozempic phase. They've lost a lot of weight and now their skin is all lax. You can put it anywhere else as well where you have lax skin, and there are proven benefits for that. So that is wonderful, and that is super safe. No downsides to that really if you put it on topically. However, even if topically, you don't want to overdo it. Now, there's this whole thing about, and I talked about this a lot with my clients and all the different topics, is more of a good thing isn't a better thing. Sometimes more of a good thing is actually bad. And a lot of the peptides are in that line of thinking, and in particular also copper peptides. Now, even if you just put it on topically, so on top of the skin, if you do it too much and too frequently, there's actually something called copper uglies, where all of a sudden the benefits go into the opposite, and it actually overstimulates your collagen production, and it can actually contribute to irritation, redness, but in the worst case, even slightly saggier skin. So the opposite of what we're trying to achieve with it. So the safest way is to really make sure you do it properly, dose it properly, and have some little breaks in between, even if it's just on the skin. Now, let's talk about the actually, in a way, slightly more exciting topic, and that is copper if you inject it, copper peptides, GHK Cu. Now, if you inject it, it's a blue liquid, and it's kind of stingy, it hurts, but that stinging doesn't usually last very long. Sometimes you can have a little bit of an irritation around it that can last even for a few hours. I've had it last for up until the next day. So in some people, they can be a little more sensitive. But the wonderful thing with copper peptides, if you inject them systemically, they actually have not just skin benefits. So they often sell copper peptides as skin glow peptides, but they actually have other benefits such as anti-inflammatory. So that's a really big one. We all know that inflammation, chronic low-grade inflammation, is one of the big factors that contributes to all sorts of bad health outcomes, whether that is current ones such as anxiety and depression and eczema and achy joints or endometriosis. All of these have an inflammatory component to them. But also down the line, the big ones like Alzheimer's, cancers, cardiovascular disease, there's a big link with chronic low-grade inflammation contributing to all these factors. So we really want to get a hold of that. And copper peptides, if you inject them systemically, have been shown to actually help with inflammation. They help downregulate something called IL-6, which is one of the big inflammatory molecules in the body. Some people have a genetic mutation there, so they are more prone to overexpressing IL-6, for example. So their copper peptides can be really helpful. It also has been shown to help with free radical damage. Again, it has been shown to upregulate something called SOD2, which helps get rid of free radical damage. And some people have a genetic mutation there as well. So if that's you, if you've done your genetics and you know where your weaknesses are, then you might want to look into copper peptides. Also, if you don't know your genetics, but you just know that there's a bit more free radical damage in your body, or you have a bit more of a free radical load from environmental toxins like heavy metals or mold or other factors that are all kind of degrading your system and causing some heavy metal load, then those factors can potentially help. Now, the factors that aren't often discussed, though, for copper peptides that I was very intrigued when I found out about them, was that it also helps with something called fibrinogen. Fibrinogen, people aren't usually that aware with what that is. It's a cardiovascular health factor. And they found in research that fibrinogen is actually a more potent predictive biomarker for cardiovascular health than cholesterol, LDL cholesterol, and those typical factors that we usually look at in a blood panel. So fibrinogen has been shown to actually be more correlated with bad cardiovascular health outcomes. And the wonderful thing with copper peptides have been shown that they help to reduce that and help balance that out. So that is really wonderful from a cardiovascular health perspective. In addition to that, it's been shown to help with our gut health. Now, a lot of people have heard about leaky gut, that gut permeability that can mess with our inflammation. It can contribute to systemic inflammation. It can also lead to hidden food intolerances. And I see this quite often in my patient population, that they have a lot of food intolerances and allergies to really healthy foods. And that is not usually a forever thing. It's usually down to a gut that is unhealthy, that is slightly inflamed, where the lining is permeable and has then contributed to the development of food intolerances. Now, copper peptides have been shown to help with that lining, strengthen that, help with mucosal strengthening. So that's the mucosa is that kind of protective layer in there. And that is really a wonderful benefit as well. Now, the other thing copper peptides have been shown to help with is actually a cellular cleanup mechanism in the body. Now, a lot of you might be familiar with the concept of cellular senescence. I've talked about this in the past. This is when we have cells that should have died, should have been taken out and cleared out, and they just linger, kind of like zombie cells. So they actually, quote unquote, call them zombie cells. They are half dead, they should be gone, but they're just lingering. And they're basically kind of polluting our system. They are inflaming our system. So they're all contributing to that low-grade, problematic sludge that builds up over time, contributing to all the big bad health outcomes down the line, reducing longevity and health span. Because if we want to live longer and a better quality of life in the long run, we obviously want to prevent cancers and cardiovascular disease and strokes and heart attacks and Alzheimer's, all these kinds of things that diminish quality of life, and we want to reduce whatever is contributing to them. And that diminished cellular cleanup mechanism can actually lead and contribute to that sludge building up. And copper peptides have been shown to help support that. So that is really wonderful as well. It helps to clean out damaged cells, mutated cells. It even has been shown in some studies to be potentially very cancer preventative. So that is also another wonderful substance. Now, the one thing that I would keep in mind if I was to use copper peptides is that a lot of the research and the systemic injections are only done on animals for the time being. So the copper peptide injections aren't currently cleared for human use. So it's really experimental, but a lot of people like to experiment with something where there's a lot of theoretical data showing that it could be very beneficial. But also, the one thing that it might not be wonderful for is if you have endometriosis, you might just want to do it once in a while and not overdo it. Now, the other two caveats that you need to be really aware of with copper peptides and not overdo them are the potential overdoing of copper in regards to Alzheimer's risk, but also in regards to copper load. So they actually found in research that Alzheimer's has a correlation with high copper accumulating in the brain. So even though copper peptides are wonderful, we don't want to overdo them because until we know it's really safe, how often to do it. We just want to do it once in a while and then pause in between, because we don't want copper to start accumulating in the brain and potentially contribute to Alzheimer's situations, right? The other factor that people often overlook is that copper can displace zinc. So if we're really upregulating copper peptides, it can stimulate copper to be too present in the body and zinc potentially to be depleted, because copper and zinc are kind of competing for their function and their absorption. Now, both of them are really important. We don't want an imbalance. So just make sure that you pause and cycle and don't overdo it. I see this all the time, sadly. Here in my client population in London, a lot of people go to their peptide experts and they just put them on high dose peptides ongoing pretty much. And it's probably just too high. Now, we don't have the human data to know how much is too much and how much is safe. So I would always err on the safe side and just do it a few times, give your body a bit of a support and a boost with this potentially very wonderful peptide. But without the potential downside of causing damage. I hope you found this helpful. I would love to know if you've experimented with peptides. Comment below, and I would like to see what you're feeling with it, because I actually think it's wonderful. So far, so good, apart from that little bit of irritation and stinging and a little bit of a rash for a few hours after on the injection side. But I'm being very cautious. I do it very low quantities and not that often. So, and I'm going to stop after that one pen and give it a break and maybe do it twice a year. But like I said, there's no definite safe guidance out there yet.